Hi everyone, Dr. Jeff back with co-student Magdalene this week, and I know Megan's got a pretty cool topic this week we haven't really talked about. It's a pretty cool idea. What we're going to talk about?
Motor reflexes.
So what are motor reflexes?
So an example of a motor reflex would be when your doctor hits you on the knee and you have a knee-jerk reaction. That's when the signal is being sent from your muscle to the spinal cord and back, and that can be called a reflex arc. It's a very localized signal pathway.
So I know when you were playing doctor when you were a kid, you would hit and try and do your reflexes, and as Megan says, it's a very localized reaction. It really doesn't travel up into your brain and back down again. It's very quick, and it's basically a test to test the integrity of your spinal cord and your nervous system. And it's very localized, Magdalene mentioned. So your knee reflex would be like L4, would be the fourth lumbar vertebrae. Your Achilles would be S1, your bicep is C5. We also do brachioradialis and your tricep as well. And again, this kind of checks the integrity of your spinal system, your spinal nervous system. And we want it to be bilateral. And we rate them 0 out of 5. So 0 will be nothing, and 5 will be very hyperreflexive. And we want them to be similar. So if this is a 2, we want this one to be 2. If this is a 5 or a 4, we want this one to be a 4. As long as it's symmetrical, we're not too concerned.
So if you have like a 0 or a minimal reaction, that can mean there's a lower motor neuron lesion, and that could be a pinched nerve somewhere between the muscle and the spinal cord. If you have a hyperreflexive reaction, which is like a greater reaction, that can mean you have an upper motor neuron lesion caused by trauma to the brain. That could be stroke, any trauma to the brain, tumor, cerebral palsy.
Yeah, things like that. So again, we want one side to be the same as the other side. So if we're taking reflexes, so we'll test Magdalene here. Oh, we got one there. Not really getting one there. If we get to distract her a little bit, so if she tries to put her hands together and pull it apart, this is a voluntary reflex. Sometimes this will allow us to, there we go. There we go. Getting one here. There we go, got that one. So once we did that, they're pretty well symmetrical. It was a little tough getting them. For people with, when we're doing their arms, we may get them to squeeze their legs together. Just try to distract them a little bit because, again, it's a voluntary reflex. So I'm pretty good with this. So we'll get Megan to test me. This should be fun. There you go. And they're pretty well the same on both sides. So again, we want them to be the same on both sides. That will give us an idea of what's happening in the nervous system. When people come in with a disc injury or an issue with the back, we'll quite often notice that their bad side will be less than their good side. Again, this gives us an idea how we localize what nerve is involved.
Absolutely. So now you know why your chiropractor or doctor might do a reflex test on you.
Yeah, so if you have any questions about anything we talked about today with reflexes, you can always send them back to us and either email or our channel here. If you want to share this with your friends, that'd be great. Give us a thumbs up. If you have anything you want us to talk about, we'll certainly research it for you and let us know. And here at Goals Do Wellness,
we got your back.